2.5 years ago, I had a surgical procedure and the sphincter muscle was cut, which caused me to have horrible nights. Horrible. I never had this happen before. At night, and this was after the surgery I had, I was having bowel movements every night. I stopped eating. I lost over 30 pounds because I didn't want this to happen. It was horrible every single night.
Fecal incontinence is the leakage of solid, liquid, stool, or even gas. Fecal incontinence is an extremely common diagnosis across the United States. In fact, 18 million people have fecal incontinence. However, it is very underreported and underdiagnosed. Certainly, the reasons for underdiagnosis is that fecal incontinence is embarrassing, and certainly this is not something that patients like to talk about. And I think a lot of patients think that is something that they have to deal with and is maybe not something that has necessarily a treatment option out there. I'm here to say that there are many treatment options out there, and certainly we can help patients. Sacral neuromodulation involves insertion of a thin electrode to the upper buttock region to help stimulate or wake up the nerves that communicate with the colon, the rectum, the sphincter, and the pelvic floor. And that, in effect, can improve their symptoms of fecal incontinence. So patients that are good candidates for sacral neuromodulation are those patients with moderate to severe fecal incontinence, and these patients have failed medical therapy. So they've failed the fiber supplementation, Imodium. Maybe they've also tried physical therapy and also failed to see an improvement in their symptoms with these modalities.
I jumped on it. And after that first 4 weeks after I had the implant, I still wore something at night. I had to, because at that time I was still having problems. I may have a couple of nights where I didn't, but I still wore something. And I waited like for 7 to 10 days where I didn't have any issues at night. And I couldn't believe what was happening, that I was normal. I felt like I got my life back because of what she did for me.
Becky is not wearing a pad anymore. She really is participating fully in her life now. This has been life-changing for her.
I have a grandson who lives with us. And my thing with my grandson is at night, we watch a movie and we have Oreos and milk. And for so long, I couldn't do that. I couldn't even have cookies and milk with my grandson because of my problem. Now, Jordan and I have milk and cookies at 11 o'clock at night, and it doesn't matter. It doesn't matter anymore.